Do you struggle to find the perfect fitness program? Perhaps you are plagued with injuries, or you are wanting to get into sport but you don't want to get injured. Well, maybe I can help you. My name's Dr. Ed, or Dr. Ed Caddye, and I am a medical doctor, but I'm trained in health optimization medicine and practice. And this is a medical specialty that provides a standard of care for health rather than diagnosing and treating diseases. So we help our clients find optimal wellness as opposed to treating their illnesses and their sicknesses. Personally, I'm also a movement specialist, and I like to use movement to optimize the health of my clients too, because I use movement in a slightly different way to most of the fitness industry. One of the frameworks that I really like in health optimization medicine that I apply to movement is this framework of being proactive about our health as opposed to being reactive. And the reason that this is important is because if you look at young athletes in their teenage years and their early 20s, the ones that manage to avoid serious injuries and avoid all these little niggles that come through are the ones that tend to be the most successful during the peak of their athletic career. If they're proactive at approaching their injury risk or mitigating that risk, then they're less likely to have these injuries, and then they can train more efficiently. They don't have to train around injuries, and they can push performance much higher. In health optimization medicine, we like to look at deficiencies and imbalances, and in some cases subtle toxicities that might be holding somebody back from the full potential of their health. And we do this before they get sick in an ideal world. So in movement, we also look at imbalances and deficiencies, and in some cases weaknesses of muscles. So for example, if one of your hamstrings or one of your leg muscles on the left is weaker than the one on the right, this is going to lead to an imbalance, and that's going to lead to an imbalance in the wear and tear on the left and the right knee, hip, ankle, shoulders, all of the joints. Now, if you receive a proper movement assessment early, your coach might be able to say, okay, we can see this imbalance, so we're going to train to make sure that we build the balance between the left and the right side. If we leave that imbalance, it might not show a problem for 10, 20, maybe even 30 years, and then suddenly you might have an injury, or you might need a knee replacement, or you might need a hip replacement because of pain that suddenly come. And that pain is a signal from your body that something needs to change. With health optimization medicine, we can use tests to see problems before they become clinical problems. We like to say subclinical. And these imbalances and deficiencies we can supplement for with either lifestyle changes, dietary changes, or give actual supplements. So if you're interested in these approaches, do reach out. There's more doctors like me, and we're training more. So if you're interested, find us at Health Optimization Medicine and Practice.